Topic is nipple retraction with the breast lump. Dear students, we'll discuss a clinical case in relation to breast lump. Just see what exactly it is, which is very often seen and often asked in the exam, and clinical oxy may be kept. So main case, long case is breast lump, so you may observe it. So what is this? See here, look at this. There is a mass here, dilated veins. Compare this right breast, left breast, everything there. Then see that nipple is not there. Here nipple is there. Here nipple is not there. So definitely there are differences are there between the right breast and the left breast. There is large lump, dilated veins, skin changes, and nipple retraction. So this is the left-sided breast lump with the nipple retraction. Probably due to left-sided carcinoma of breast, where carcinoma of breast infiltrates the lactiferous duct close to the nipple area. So nipple get retracted, and eventually it may involve the areola or may cause ulceration. Lump is visible, dilated veins, skin may get involved, pudy orange can occur. So here nipple areolar complex is involved. It's a large tumor. This is here in this patient, it's a large swelling, a large lump actually. So you have to examine the lump, temperature, tenderness, size, shape, extent, which quadrant it is used, involvement of the skin, tethering, puckering, dimpling, and nipple areolar complex, nipple retraction, bleeding, the bleeding from the nipple, then mass is fixed to the breast tissue or not, and attached by feather is fixed to the petrolus major, latissimus dorsi, serratus anterior. Petrolus major is like this, contractor petrolus major. Latissimus dorsi is against resistance like this. Then check the mobility. Petrolus major is like this. When you do like this, check the contraction by feeling the anterior axillary fold. Then check the mobility of the breast lump. Before that, normal without contraction, you have to check the mobility. Petrolus major, latissimus dorsi is like this, against resistance extension, and serratus anterior is extended, outstretched elbow, push it against the wall, then check the mobility. So 3 muscles are important to check. Then axillary lymph node you have to inspect, then anterior, central, lateral, apical and supraclavicular lymph nodes has to be checked. Always examine opposite side, opposite axilla, supraclavicular lymph node. Then respiratory system for pleural effusion, ultra-breast sound, abdomen for liver enlargement, free fluid, and parietal examination, pervaginal examination, spine examination is very, very important. Spine is the commonest, bone is the commonest site of spread for carcinoma breast. In that, spine is most common, and lower spine, lumbosacral spine, and pelvis is much more common. And it is osteolytic commonly, maybe osteolytic and osteoblastic combined type of secondaries. So if you look for the spine tenderness, paraspinal spasm, and movement, flexion, extension, lateral flexion, and rotation in sitting position, because they fix the pelvic girdle. So that is in brief how to examine. So systemic exam is also important in this patient. And for brain involvement in neurological epilepsy, recent onset of convulsions and so on, all those history also should be done. So proper examination is very, very important. It's a long case always. It is a long case in the exam, and many short notes, main questions may be asked: early breast cancer, how to manage, and local advanced breast cancer, LACB, metastatic breast disease, how to manage, and so many short notes will be asked, different hormone treatment, letrozole, tamoxifen, so everything you should know. So read my SRB's manual of surgery and current edition, breast chapter, everything with the anatomy, procedures, operative surgery, mastectomy, different types, chemotherapy, radiotherapy, oncoplastic surgery briefly, and nipple retraction, clinical examination. And also read my SRB clinical methods in surgery with the video how to examine a patient, detailed methods and principles of examining the breast lump. Axillum examination is very typical method is there, proper clinical method. That also you should know. Of course, with the table, with the differential diagnosis, no management in the clinical method, but manual gives everything with the illustrations, photos, with the quotations. So you can always purchase and get, so that you will have entire knowledge about the breast disease as such. So nipple inversion, retraction, there are two different things. Nipple inversion is congenital, developmental. Very common it is, remember, 25%, because you have to ask the history. It is a recent onset after a development of breast lump. It is a retraction related to the breast lump, probably carcinoma. If they are since childhood, it probably nipple inversion, congenital, may bilateral with the infant feeding, but it can cause inflammation, infection, periductal mastitis, all those things. Can do the surgical correction, not a major thing as such. It's a benign and horizontal, remember. Where this is circumferential, it's a pathological, it's retracted. It can be seen in ductaceae, carcinoma, previous surgery, and all those things. See, it is circumferential. This is slit like commonly horizontal, this is circumferential. So retraction is very specific, inversion is congenital. Just to want a meaning looks almost alike, but history is very important. That is a point which you have to remember. So for this detail, this one read my manual of surgery, Bhat chapter, and clinical methods in surgery, again Bhat chapter. So students, again I request you to go through my manual of surgery and clinical methods in surgery. Have the book sufficient for you to cover oxy, everything for UGs, PGs of different specialties, and also go through my SRB's surgical inside YouTube. Subscribe it, bell the ring, and share with your friends and colleagues for updated daily lectures of 5 to 10 minutes about images, clinical case, x-rays, instruments, brief operative procedures. Very, very interesting. And also once in 2 weeks live session of different interactive clinical presentation with the senior professors in online for your benefit. Also you will get a certificate if you join live session. So students, go through this MCQ, find out the right answer. I'll appreciate your right answer. ABCD, treatment for rectal is ABCD, find out the right answer. Another treatment choice of breast papilloma is, this is rectal is a breast papilloma treatment, ABCD, find out the right answer. I'll appreciate your answer and acknowledge, put it in the comment box. So quotation of the day is, mistake is easy to judge when others do it and difficult to realize when we do it. So we always comment on others' mistake. We won't realize and we won't be bothered about our mistake. We are bothered more about others rather than ourselves. That's what most of the time nature of human beings. So there is what mistake actually. That's what this quotation says. Absolutely right, as far as the basic human nature is considered. Students, again, I request you to join my YouTube channel, subscribe, share with others. So students, I hope you have understood this lecture very well. Thank you so much.